I'm here from the Economic Policy Institute, and we are a nonpartisan, nonprofit, national policy think tank that was founded about 40 years ago, specifically to focus on analyzing and advocating for policies that improve conditions for low and middle income Americans. One of the things that Economic Policy Institute folks study very closely is the degree to which our economy has been growing more unequal year by year for almost 50 years now. And whether there are different ways to measure that, but whether we're looking at the big gap and divide between folks at the top income brackets and the vast majority of everybody else. One of the things our folks study every year is what's the ratio of what CEOs are being paid to the average worker. Or if we look at, this is probably our most famous chart on the right, which is looking over time from the early to the mid 20th century up to the present, at the relationship between productivity in our economy as it's increased, and the reality that starting around the late 1970s, the wages, the income that workers were earning as that productivity went up, stopped increasing, that we've sort of been in a flat line. I'm mentioning this because the things we're talking about tonight are one of the handful of things that we do in our country to try to mitigate some of that inequality, and just acknowledging that even the programs we do have not always been adequate. Part of the reason we're here tonight is that there's so much complexity and so many different programs that try to fill different gaps but don't quite ever fill all the gaps. So this is just a quick reminder of what some of those programs are that we're going to be talking about tonight. One of the big ones that you'll hear a lot about is Medicaid. And in Iowa, that there are elements of it that go by different names. I'm going to leave that up to the experts to explain what some of those names are. But if you've heard of Hawkeye, for example, that's part of Medicaid in Iowa that covers children with health insurance. We're going to talk a little bit about Medicare, which is the program in our country that once you turn 65, does finally guarantee healthcare for everybody. Up till then, we don't have a solid guarantee that everybody's covered. We are going to talk a little bit about the Affordable Care Act, otherwise known as Obamacare, which was healthcare reform legislation. We've been through quite a year in the federal policy arena. Many changes, often day to day, new policies rolling out. And so I'm certainly not going to catalog them all. I want to mention the budget bill, otherwise known as the Big Beautiful Bill Act, that was passed over this summer. Many of the changes in those programs that I just listed, that you're going to hear more details about tonight, are coming about because they were included in this really enormous piece of legislation that was partly about setting the new budget for the country, but that included very dramatic changes in some of those programs, including Medicaid in particular. And the note I have up there about that this bill really represented a massive upward transfer of wealth is me quoting some of our EPI economists and their analysis of the very significant cuts to Medicaid, which are, of course, that's the program that's designed to make sure we don't have low-income children and adults falling through the cracks with no health insurance coverage. Those cuts are so dramatic that the lost income of people who have relied on Medicaid in the past is fully offset by those cuts were made, here's what I'm trying to say, by the majority party in the Congress that passed this bill in order to fund the extension of very enormous tax cuts, mostly that will accrue to the wealthy. So that's what some of this chart is laying out here, is the value of Medicaid that may be lost for 40% of households in our country. So it's a real blow to an already unequal economy, making it more unequal. First, our website is epi.org. There's lots and lots of information there, much more than I'll mention tonight. But some of the other issues that our economists are analyzing is how these cuts to programs like Medicaid and SNAP and potentially the Obamacare, the Affordable Care Act, are layered on top of other federal policy changes right now that are already or are threatening to make our economy even more unequal, especially for working people and low-income people. We also know that the impacts of these cuts are disproportionately borne, and that part of the inequality we have in our economy that we have inherited from a long history is along lines of race and ethnicity. And so we know that the cuts will be borne more heavily by children of color in particular. Right now, we're meeting tonight at a very critical juncture. Folks, I'm sure, have heard that we're in the midst of federal government shutdown, and the shutdown really has a lot to do with the issues we're talking about tonight. The Democrats in Congress have refused to sign on to Republican legislation right now, unless the thing that they're asking Republicans to change is the threat right now that subsidies in the Affordable Care Act that are helping most low and middle income Americans who are on private insurance afford that insurance are right now scheduled to disappear at the end of the year. And so that's the number one debate that is causing the shutdown right now. So it's very, we're meeting at a very, very relevant moment. And the other implication of the shutdown that folks are beginning to be quite concerned about is that if it lingers on into the end of the month, there are also Republicans are threatening not to fund SNAP benefits starting in November.